Okay, so now I believe we are going to invite Debbie Denardi from Force to discuss advocacy in breast cancer. Welcome.
Thank you very much. Okay, thank you very much for the warm welcome. This is the first time that I'm presenting my advocacy journey to this type of audience, so thank you for the welcome. I'm really very excited today because I wanted to share a little information about Force. That Force is the organization that helped me when I was diagnosed with triple-negative breast cancer and a BRCA1 mutation. They educated me and our community how to face this diagnosis and how to advocate for our health. So what I wanted to share with you is what we are going to talk today. Three things. I'm going to share my story. I'm going to share my advocacy journey that it's been for the last 10 or 12 years. And also I'm going to share some information and advocacy and support that you can share with your patients so we can continue educating patients to continue this important work. Because I hope that at the end of this presentation, what you are going to be able to get is to get a little more information about patient education, research, treatment, and also access to care, insurance coverage, and at the same time, we have the same objective, is to save more lives. So let me tell you a little about my cancer story. My mom was diagnosed with breast cancer. Back then in the 70s, there was not triple-negative breast cancer. It was breast cancer, and she was diagnosed at the age of 39 years old. And she passed away when she was 44 years old after surgeries and radiation. And I was 13 years old, my sister was 11, and then three of her sisters, two of them, they passed away of breast cancer, one of ovarian cancer at very early age too. From my father's side, my father was diagnosed with prostate cancer, my grandfather from that side with colon cancer, and they passed away from those diseases. So I have a large family history of cancer, and I was never offered genetic testing. I was diagnosed first with triple-negative breast cancer, and when I discussed that with my oncologist, they said, oh, you qualify for genetic testing because they look at the family history. So, but before that, I had many other signs because when I was 34 years old, I had a few fibroadenomas. When I was 35, I had basal cell carcinoma. At the age of 36, I have polyps in my intestine. So really, I had a lot of different signs that there was something in my DNA. So finally, in 2009, I went for my mammogram, and that was a clean mammogram, ultrasound. 4 months later, I felt a lump, and I went back to my doctor, and he was so puzzled because he was looking at the mammogram and the ultrasound, and where was that lump? It was not there before. So he thought that it was really fast growing. He did the biopsy, and then he recommended, back then in 2010, it was a lumpectomy. Based on the biopsy of the lumpectomy, he recommended to see an oncologist. The oncologist is the one that did all my chemo treatment, and I did not have radiation treatment because my lump was on my left side here, very close to my heart. So they decided not to have radiation treatments directly. They recommended double mastectomy and a hysterectomy because of the high probability of recurrence and also having ovarian cancer. So after I finished all that, also we tested my sister, and my sister also tested positive, and we are two only. So now for me, it's a mission for me to educate myself, for my family, for our community, and for our kids, because I really want to make sure that when they grow up and they decide to have kids and everything, if they carry the mutation, to be able to have some solutions for them, or at least some alternatives that we didn't have when we were going through this. So I did not know anything about hereditary cancer. I learned really fast. And now I share my story because it's very important for other patients to know that they can do something, that they can be informed and they can make decisions in order to prevent, not prevent cancer, because we cannot say prevent it, but we can say that we can diagnose it early enough to be able to treat it. So for us, information is power. So I wanted to share with you, because in the last few years, patient advocacy has been expanded tremendously. At the beginning, I'm going to tell you, based on my journey, that I started with number 2, that it was support. I started attending support meetings. It was for emotional support, for medical advice, for financial support, also for legal support if health insurance was not covering some type of treatments. After that, I said, well, I need a little more education. So I went to the other stage where I started just reaching out to different advocacy organizations just to obtain a little more education to help me and other patients navigate the cancer treatment. After that, these same organizations, they train patients in policy advocacy. So I was trained to be an advocate for breast cancer by telling our stories. I went to Washington, D.C., I went to Tallahassee, just to talk with representatives and senators that they listen to our stories in order to make a difference in health insurance. I'm going to give you some examples later on. And then in 2019, I had the opportunity to go to the San Antonio Breast Cancer Symposium, and there, with a group of other advocates and researchers, we started walking through the poster sessions. And we were small groups, a clinician, a patient advocate, and the researchers, and we were discussing the research that they were presenting. And it was such a fantastic experience because each of and every one of us, we learn a lot. Patients will learn from researchers and clinicians. What was astonishing is that when I talked with one of the researchers, they said, this is the first time that I'm talking to a patient. So it was like eye-opening because they are doing research for cancer patients that they've never talked with a cancer patient. So really, there's where I'm spending a little more time now with research. So this is the type of training that I mentioned to you, San Antonio Breast Cancer Symposium, ASCO. We don't go to the conference itself, but many advocacy organizations, they offer training for advocates, like in San Antonio, the Alamo Foundation, they offer training for patients. At the ACR, there is a survivor scientist program where they put us together with scientists so we can discuss the science behind, and they learn from us, we learn from them. Locally, I don't know if you're aware of the Day of Caring. That is an event that we do annually that is sponsored by Baptist. Also, Total Health, they do an Empower event where they train patients to learn the science behind breast cancer, while telling our stories, providing peer support. Also, I attended the National Breast Cancer Coalition. They offer this program that is called Project LEAD. Project LEAD is, they teach you all the biology behind cancer so we can at least understand the terms when we are reading a grant, when we are reading research, we are able to ask questions. And also to represent the patient in research and clinical trials. For that last one, as we get a little more training on research and clinical trials, I am one of the reviewers from the patient side for the Department of Defense when you present grants, and also Susan G. comments that they offer grants also for researchers. I represent the patient, and I can give them my opinion on how much impact that research has on the patient. So really, it's very important because we have the same vote within the researchers that they're reviewing the grants, and really they're listening to the patients. So because they're limited resources, so they have to select those those research programs that they really need to be funded to have higher impact for the patients and faster results for research. And this is just a summary of different types of public advocacy that I participated with the Florida Breast Cancer Foundation, where last year we were asking for funding for cancer screening. The American Cancer Society, that is the Cancer Action Network here in Florida. This year we are discussing biomarker testing that insurance doesn't cover it. So we want to make sure there is a bill now in our Capitol that they are talking about biomarker testing. In March also, I participated with Susan G. Komen and Force. We were advocating in Tallahassee. We went in person finally to discuss diagnostic imaging, because as you know, health insurance, they cover the screening mammogram 100%. When there is an abnormality, the physician recommends to do a diagnostic mammogram or an MRI, but all those tests, those diagnostic tests, they are not covered 100%. The patient needs to have a copay that sometimes go from $200 to $1,000. Some patients cannot afford to do that, and this is for patients that they have insurance. So really, it's very important that insurance companies can cover this copay, because if they do not cover it, a patient can decide to delay the diagnostic, and that is going to have a detriment in their treatment and outcome. So that is what we are advocating right now. Then at the national level, I was able to go to Washington, D.C. and the National Coalition of Cancer Survivorship. We want to make sure that insurance companies cover the survivorship care plan, because I know that many of you does the survivorship care plan, but you have to code it differently because it's not covered by insurance. So we want to make sure that you dedicate enough time and you prepare that survivorship plan for the patient to walk away and have a plan after finishing cancer treatment. The National Breast Cancer Coalition also, they asked for more funding for the Department of Defense and also for insurance, just to make sure that more grants and more research is being done. And this May, we are going to advocate with force also in DC, because there is a new bill that is called Reducing Hereditary Cancer Act. This bill, what we are asking for is for Medicare to cover genetic testing for patients that do not have cancer yet, because now Medicare covers it only if the patient is diagnosed with cancer. So if that happens, then it's going to trickle down, and we are going to be able to have commercial insurance that they are going to cover genetic testing for people that have not been diagnosed with cancer yet. And just what I mentioned before, in 2008, we were able to support and pass the GINA Act. That the GINA Act is the Genetic Information Non-Discrimination Act. That is the one that insurance companies and employment, they cannot discriminate against genetic predisposition. Unfortunately now, as I mentioned, here in Florida also it includes life insurance and long-term care. I wanted to go to the next one, that really this is what it's so important right now, that we are working together with researchers together with patients. There you can see really some of the objectives, but I wanted to give you a few examples. I met a researcher and she said, I'm opening my lab and I'm going to recruit some new researchers. Would you be able to come and talk with them just for them to see the patient face? So we scheduled some time. I told them about our experience and everything. And it was such a great experience because they are just having the eye on the patient, not the eye on the microscope and what they are doing right there. So really it gives them meaning and purpose when they know that they are helping patients. Another one that I mentioned to you is during San Antonio, where we were reviewing all the posters, and really that interaction that is maybe for an hour, just walking through with the patient and a researcher, a clinician, all together, we can review posters and we can learn from each other, because sometimes the clinician said, oh, I never thought that the patient had that need. Or the researcher said, oh, I never thought that really that was important, like the side effects and so many issues that we have and we can share with researchers and patients. So really, and the other thing is that by meeting all these researchers, why is it important? Because right now, for them to obtain any type of grants, they need to have a letter of support, 1 or 2 letters of support from a patient advocate. So really that relationship helps both sides. The researchers, because they have a patient advocate that they can get the letter of support and also include them when they're going through the grant process. So we are going to be able to go through this process and do it faster. So I'm running out of time. I just wanted to summarize that really this is just the tip of the iceberg, just for you to understand that patients advocacy went through a lot of things, and we provide support, we provide research, education, and also advocacy and public policy. What we need from you maybe is to refer more patients that they want to do this so we can train them, and the more patients we have to continue this journey is going to help us all to find the cure for breast cancer. Thank you so much.